Good afternoon. This is All India Radio and I am Abhishek Mukhopadhyay with the Midday News. The headlines. Trade and investment ministers of G20 countries decide to keep their markets open and ensure continued flow of vital medical supplies. 24 people who took part in a religious congregation in Nizamuddin area of Delhi test positive for novel coronavirus, says State Health Minister. Centre extends validity of health organisations already impanelled under Central Government Health Scheme till 30th June. Cargo flights, including private airlines, are supplying medical essentials to eastern, northeastern and southern parts of the country. And government says there are no signs of community transmission yet in the country. The trade and investment ministers of the G20 and the guest countries have decided to keep their markets open and ensure smooth and continued operation of vital medical supplies and logistics networks. A statement issued at the end of the meeting said that emergency measures designed to tackle COVID-19, if deemed necessary, must be targeted, proportionate, transparent and temporary. The measures should not create unnecessary barriers to trade or disruption to global supply chains and be consistent with WTO rules. In the second such meet through video conferencing, India has called for creating global framework for further enhancing affordable access to medicines for fighting pandemics and facilitating easier movement of health professionals across national borders. In his interventions, Commerce and Industry Minister Piyush Goyal stressed on the need to uphold multilateral commitments and improve upon its effectiveness to meet current challenges. The minister expressed confidence that with improved regulatory and research and development cooperation, India can further enhance its capabilities to serve the world in a crisis like this. 24 people who took part in a religious congregation in Nizamuddin West earlier this month have tested positive for the novel coronavirus. Delhi Health Minister Satyendra Jain today said around 1500 to 1700 people had assembled at Markaz building in Delhi's Nizamuddin area, which has thrown up several corona cases. He told reporters that 1,033 people have been evacuated so far and around 334 of them have been sent to hospital. Mr. Jain informed that 700 people have been sent to quarantine centre. Yesterday, Delhi government had said strong action will be taken against those in charge of this religious gathering. It said social distancing and other lockdown measures were not followed in this event. Delhi Lieutenant Governor Anil Baijal has asked the city administration and police to keep very strict watch on social distancing and home quarantine and take deterrent actions for any violation. In his daily video conference meeting with Chief Minister Arvind Kejriwal, Delhi police and other senior officials today, Mr. Baijal said there have been reports about violation of social distancing norms at some food distribution centres. During the meeting, it has been decided to increase the number of food distribution centres from present 500 to 2,500 so that social distancing is adhered to effectively. Centres extended the validity of health organisations already impanelled under Central Government Health Scheme CGHS. An order issued by the Ministry of Health and Family Welfare said this extension will be valid till 30th June this year or the next date of impanelment, whichever is earlier, on the same terms and conditions and rates. However, all hospitals and diagnostic centres shall charge National Accreditation Board for testing and calibration laboratories NABL rates only for investigations conducted by them which are NABL accredited. For all other investigations, non-NABL rates may be claimed. In Maharashtra, the state government has decided to deduct nearly 60% of monthly salaries of the Chief Minister, Deputy Chief Minister, all members of the legislature and local civic bodies institutions. The decision was taken in view of the increased financial burden due to the outbreak of corona in the state. According to a release from the Deputy Chief Minister Ajit Pawar's office, salaries of all the representatives of the people will be reduced to 60% for the month of March. It said that the salaries of the government officers of the A and B classes in the state will be cut by 50% and they will be paid half of their salary, while the employees of C class will get 75% salary. However, no deduction is announced in the wages of Class D employees. The release stated that the decision is taken in consultation with representatives of state government officials and staff organizations. In Mizoram, statewide lockdown has brought in a deserted look and environment with ambience of complete shutdown everywhere. Handful of people have been noticed in locality circles to buy most essential commodities while maintaining social distancing. Meanwhile, another scene is noticed where people are coming forward with the message of a good Samaritan. Our Aizawl correspondent reports that about 400 tailors and designers across the state came forward in making and donating disposable protective apron and scrubs, masks for health workers for control of infection.
Mamit Venglun Village Council President Lalchandama said, after learning that Mamit District Hospital does not have enough personal protective clothing, tailors get together with local authority and made commitment that they will make these aprons. From day one, these tailors have begun sewing aprons to help the health workers. Also in Aizawl, many tailors and designers came forward voluntarily to produce protective clothing for the medicos. Officials said that there have been acute shortage of personal protective equipment. However, a good volume of such consignment sent by the central government has arrived at Aizawl. Irene, AIR News, Aizawl.
Kerala has reported second death due to COVID-19 today. A report.
Medical Superintendent of Government Medical College said that the person had history of thyroid, high BP and suffered kidney failure. He had been under treatment here since March 23rd. Meanwhile, Minister Kadagampally Surendran said that there is certain evidence regarding the source of infection in the disease, even though he has not travelled abroad or have anyone in close circle with travel history, but had attended few functions with Gulf-returned individuals. Minister further said that there is no situation of panic and all the people who were in touch with the deceased is quarantined and no one had exhibited any symptoms yet. State Health Minister K.K. Shailaja said that there is no evidence of community spread in the case. Mayusha for AR News from Thiruvananthapuram.
In a series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. S. Rajeshwari, Department of Anesthesiology, AIMS, has advised the people to stay at homes and maintain hand hygiene.
We have seen that there is a severe shortage of ICU facilities in the most developed of countries. And in order that we do not face the same calamity in our country, it is vital that we do not stress the health system by becoming more sick and bringing more patients. And for this, I urge that you must stay at home and must maintain hand hygiene to reduce the number of patients coming into the hospital.
Medical expert Dr. Mala Srivastav emphasizes the need of strong immunity and good diet.
इम्यूनिटी बढ़ाने के लिए सबसे बड़ी बात है कि एक तो रेगुलर एक्सरसाइज अगर पॉसिबल है तो करिए, क्योंकि मोस्टली सब लोग अब घर में रह रहे हैं तो जो दिनचर्या होती है तो नहीं हो पा रही है, तो कोशिश करें किसी न किसी तरह के कोई भी व्यायाम कर से तो अच्छा है. सेकेंडली, अच्छे से रिलैक्स होकर सोएं, क्योंकि रेस्ट इज ऑल्सो इम्पोर्टेंट. तीसरा है खान पान का. खान पान में जितना सात्विक भोजन ले सके उतना अच्छा है. ज्यादा तेल, घी, मसाले ना लें तो अच्छा है, ताकि डाइजेशन इजी हो. प्रोटीन डाइट अगर ले सके तो अच्छा है. तो इन 3-4 चीजों का ध्यान रखेंगे तो हमारी इम्यूनिटी बढ़ेगी.
In the wake of growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress on several preventive measures like social distancing, personal hygiene and restriction of mass gatherings. A report.
Government has said that there is enough supply of essential items and people need not worry and rush to marketplaces. People are advised to have patience and keep calm while shopping for essential goods and medical supplies. Frequent trips to buy essential items should be avoided and people should refrain from shaking hands and hugging as a matter of greeting. At least 1 meter distance should be maintained by people at marketplaces, medical stores and hospitals. Non-essential social gatherings at home should be avoided and visitors at home should not be allowed. People should not touch their eyes, nose and mouth, and frequent hand sanitation is a must. Both sides of hand have to be washed for at least 20 seconds. If a person is experiencing cough and fever or any other symptoms, he or she should avoid close contact with others and doctor should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public for enquiry about coronavirus. All Indians must do their bit and keep themselves and others safe in this fight against COVID-19. With Bhupendra Singh, Suparna Saikia, AIR News, Delhi.
This is All India Radio giving you the news. For quick news updates, visit our News on AIR app and follow us on Twitter at AIR News Alerts. You can also visit our website www.newsonair.com. Cargo flights are carrying medical supplies to eastern, northeastern and southern parts of the country. Civil Aviation Ministry said in a release that private airlines such as Indigo, SpiceJet and Blue Dart are also carrying out critical supplies. The total cargo load carried from 26th to 29th of this month was 10 tons. The cargo essentially covered COVID-19 related reagents, enzymes, medical equipments, testing kits and PPE, masks, gloves and other items requisitioned by states and union territories. Prime Minister Narendra Modi today said he practices yoga Nidra once or twice a week whenever he gets time. In a tweet, Mr. Modi said yoga Nidra furthers overall well-being, relaxes the mind, reduces stress and anxiety. He also shared a video in English and Hindi on yoga Nidra. Health Minister has confirmed that 1,251 positive cases of coronavirus in the country. Out of this, 102 patients have been cured and discharged. A total of 32 deaths have been confirmed by the ministry. Meanwhile, briefing media in New Delhi yesterday, Joint Secretary in the Health Ministry, Love Agarwal, said that the cases reported in the last 12 days are much less than those reported in the developed countries. He said this happened because of the cooperation of people of the country, a collective preemptive action, social distancing and enforcement of lockdown. Mr. Agarwal said there is no evidence of community transmission in the country and it is at local transmission. He said as the country is battling against an infectious disease, the people are required to be alert and follow the guidelines issued in this regard. People across the country are following government's appeal to stay in their homes during the lockdown period. To deal with the present situation, people are engaging themselves in different activities like completing the household chores, playing indoor games, reading books, doing gardening and pursuing their hobbies. We spoke to a couple of persons who shared how they are utilizing their time during the lockdown.
I'm Vikas Panikar from Kozhikode, Kerala, which is also known as Calicut. I am a media professional. This period has given me time to read books and I listen to music. I've just recently shifted to Kerala, so it's good that I'm using this break as a time to catch up with my own family. So that is a good thing out of this.
I'm Simple Mishra from Bhubaneswar. I am spending my days by reading, by finishing projects and by managing everything in a house setup. This has been a time to meditate, to self-reflect and a break that has come as a welcome change.
In an effort to guard against fake news being circulated on various platforms, we bring you a new segment on fact-checking and Mythbusters. Government has come across reports in a section of social media which shows pH values of select food items and tells the people should have more intake of alkaline foods that are above the pH level of the novel coronavirus. The report refers to the findings of research study published in the Journal of Virology and Antiviral Research. This is fake news and is factually incorrect. The research report referred to in the Journal of Virology and Antiviral Research is related to a completely different coronavirus, mouse hepatitis virus type 4 or MHV4 and not COVID-19. The report was published way back in 1991. There are many factual mistakes in the report regarding pH values of different items. No research report regarding use of more alkaline food intake to combat coronavirus has been validated. However, extrapolating the same for any food is incorrect. Be aware of such misinformation and do not fall for such news. Stay home, stay safe. In Manipur, nationwide lockdown called on as part of the preventive measures against spreading of novel coronavirus disease has been underway in a peaceful manner. Reacting on news of violence by public in Churachandpur district shown in some TV news channels, SP of the districts, Srimati Amrita Sinha said, no violence or unwanted situation has been reported in the district since implementation of lockdown. And now, before we end the bulletin, the headlines once again. Trade and investment ministers of G20 countries decide to keep their markets open and ensure continued flow of vital medical supplies. 24 people who took part in a religious congregation in Nizamuddin area of Delhi test positive for novel coronavirus, says State Health Minister. Centre extends validity of health organizations already impanelled under Central Government Health Scheme till 30th June. Cargo flights, including private airlines, are supplying medical essentials to eastern, northeastern and southern parts of the country. And government says there are no signs of community transmission yet in the country. And for details of these stories and more, visit News on AIR app and log on to our website www.newsonair.com. And with that, we end the Midday News.